Welcome back. I'm nurse educator Chelsea, and today we're going to be talking about vital signs. Vital signs include temperature, pulse, respiratory rate, oxygen saturation, blood pressure, and a pain assessment. Vital signs can provide important information about a patient's health status. Depending on facility policy, obtaining some of these vital signs can be delegated to assistive personnel, but it is the nurse's responsibility for interpreting the findings. Temperature is the first vital sign I'm going to be covering. A normal temperature is considered to be 97 to 99 degrees Fahrenheit or 36.1 to 37.2 degrees Celsius. Measurement sites for temperature include oral, rectal, axilla, tympanic, or temporal. It is important to know that a rectal temperature will generally be 1 degrees Fahrenheit higher than an oral temperature measurement, and if a temperature is taken by axilla or by temporal, then the temperature will be about 0.5 degrees lower. What is considered a fever can vary slightly between providers and between facilities, but a fever is generally considered to be above 100.4 degrees Fahrenheit or above 38 degrees Celsius. Those with a fever can feel warm to the touch, report feeling feverish, be flushed to the face, have glassy eyes, or have chills. Temperature can fluctuate throughout the day with environmental temperatures, age, with activity, pregnancy, or throughout the menstrual cycle, or with illness. The next vital sign is pulse. The average pulse rate for an adult is 60 to 100 beats per minute. Pulse rate can slow in certain conditions, such as with age, certain medications, or with cardiovascular conditioning, as we can see in some athletes or in runners. Pulse rate can be elevated when actively engaging in exercise, with emotions, pain, elevated temperature, stimulant medications, or with low blood pressure, or a decrease in circulating volume. The nurse should be the one to assess whether the pulse feels regular or irregular. Next is respiratory rate. A normal respiratory rate for an adult is 12 to 20 breaths per minute. Many factors that affect pulse can also affect respiratory rate. In addition, smoking, anxiety, or body position can affect respiratory rate. An elevated level of carbon dioxide or a decreased level of oxygen in the blood can lead to an increased respiratory rate. Head injury or increased intracranial pressure can result in shallow or slowed breathing. Some medications, such as opioids, can depress the respiratory drive. Depth and pattern of respirations should be assessed by the nurse. Blood pressure is our next vital sign, and blood pressure is expressed by two different numbers. The top number is systolic blood pressure, and this is the maximum pressure when the heart is pumping. The bottom number is the diastolic blood pressure, and this is the pressure when the heart is at rest. A normal systolic blood pressure is less than 120, and a normal diastolic blood pressure is less than 80. Blood pressure can be affected by age, stress, ethnicity, smoking, medication, body position, or body weight. When measuring a blood pressure, make sure to use an appropriate size blood pressure cuff. Using an inappropriate size blood pressure cuff can lead to inaccurate measurements. Up next is pulse oximetry. A normal value for pulse oximetry is 95 to 100%. Pulse oximetry measures oxygen saturation in the hemoglobin through a sensor applied to the patient's fingertip or earlobe. Although a normal value is 95 to 100%, we can see lower readings in those with chronic respiratory illnesses or those experiencing an acute illness. Sensor readings can be affected by fingernail polish, sensor movement, hypotension, anemia, and peripheral vascular disease. Generally, patients with decreased oxygen saturation levels will need supplemental oxygen at least temporarily. And our last vital sign is pain. Pain can be acute or chronic, but it is a highly individual experience. The nurse will be assessing for location, severity, quality, timing, precipitating factors, and what has been attempted to relieve the pain. A number-based scale is commonly used with adults. With those that have cognitive disorders or are unable to describe their pain, an alternative nonverbal pain scale may be used. There are several different types of pain scales that can be utilized in different situations. Thank you for coming to learn with me today. Please remember to rate, review, and subscribe to get the latest updates on my channel.